Vanderwater from District 22, which is Cuna, Meridian, and Boise. A little bit of everything. That's kind of what I am. And so, committee, I bring before you House Bill 617, which is a repeal of the needle exchange program. If you had paid any attention to what was happening in the news, you saw some disturbing news where two of the facilities in this valley were raided by police due to some controlled substances that weren't supposed to be there. And we have annual reports that are supposed to be given from the needle exchange. And what I got was just one page for an annual report from this year. And so I think it's time to take a good close look at this thing, to repeal it and start over and have a lot better insight and oversight over how this is handled. Apparently, my look at it at this point is there's just no oversight, and it's gotten out of hand and needs to be repealed and something else put in place that has a lot better oversight. I'll stand for any questions.
Representative Blanksma.
For a motion.
Motion's in order.
Motion to send House Bill 617 to the floor with a due pass recommendation.
Okay, we do have testimony on this one, for both virtual and in person and written. So committee, if you would take time to look at the folders. We will start with our in-person folks, and we have Amber LaRocco. Please state your name and affiliation, and then the podium is yours.
All right, thank you. My name is Amber LaRocco, and I'm here representing myself. I'm a certified alcohol and drug counselor with 18 years of experience working in the treatment field. I'm also a person with long-term recovery, just having 19 years of abstinence from IV drug use. I'm here today to speak to the opposition of House Bill 617, which aims to repeal Idaho's Safe Syringe program. As someone who has personally experienced the devastating consequences of someone I love not having access to harm reduction services, and I urge you to consider the human impact of this bill's proposed repeal. On May 17th, 2022, I lost my brother, Brian Larson, to a drug overdose. Brian had purchased his syringes at a local pharmacy, not knowing or having access to a harm reduction agency that would have been able to assess his needs and risk and provide him with Narcan. At that time, harm reduction agencies were not available in Nampa, but if he visited one in Boise, a trained professional could assess those needs and provided him with a life-saving measure. Instead of that, Brian became a statistic to Idaho's overdose loss. SSPs are not only about preventing overdose, they also connect individuals with vital resources such as addiction treatment, HIV and Hep C testing, health care, and social services support. By investing in reduction strategies like SSPs, we can address the root causes of substances and help the people like my brother. I stand before you today to advocate not for the repeal of this law, but to looking at amending the rules, implementing guidelines and structure. I'm passionate about treatment. I am passionate about our community. I stand before you as a sister who has lost a brother, an aunt who has lost a niece, and as a member of our community who's had a loved one out there, just hoping that someone somewhere could provide them with services. Repealing the Safe Syringe program law without considering the lives it would save would be a short-sighted decision. Instead, I urge you to consider amending the bill to include regulations and guidelines and implementing sensible rules and oversight. I implore the members of the Health and Welfare Committee to carefully consider the consequences of repealing the law. I advocate for collaboration with the treatment and medical experts in our state, and let's work together to find a solution that prioritizes the health and well-being of all Idahoans. Thank you.
Committee, any questions for Ms. LaRocco? Seeing none, Representative Roberts.
Thank you, Mr. Chairman, and thank you, Ms. LaRocco. Outside of these needle exchange programs or harm reduction programs, how does a person with a substance use disorder find out about opportunities to be able to, enter a rehabilitory program, a method to get themselves off of these drugs? Is there any effective means that we're using to message to these individuals that they have an opportunity to change their lives?
Ms. LaRocco.
Thank you for the question, Representative Chairman. I believe that one thing Idaho could do better is be more outward in our support of treatment services for our people. Treatment is available, yes. I would say word of mouth, probation and parole, other offices where they are sent with duress, right, under duress of treatment. But what happens when people come to a harm reduction agency, from my understanding, is they're 5 times more likely to engage in treatment services per the CDC, right, on their own accord. And so if we can make treatment services something that we talk about, normalize treatment services from a government standpoint, from a community standpoint, outside of that, it's going to be word of mouth from people that they know. It's going to be when they've come through the court system and they're reported to attend treatment. And I think that we can really start to put in some measures that would intervene before it gets to that point. And I believe that's what harm reduction and SSPs do.
Follow up.
Thank you, Mr. Chairman. So when a person enters the legal system and they're directed through that, portion, how effective is that in working to get these people into a real rehabilitation system? Or is it, are these individuals readily willing to go into that, or are they more likely to push back against the legal system and forcing them to do that?
Ms. LaRocco.
Thank you, Mr. Chairman. Representative, I think that's a difficult question to answer. I think that professionally, the people I encounter, people want to do different, right? It is not ever a great day to wake up and have to use drugs to be okay. But we look at it and we have circumstances that get in the way, and there's barriers. There's housing, there's employment, there is family, there's shame, there's guilt, there's trauma. All of these things that are a barrier to treatment and doing something different. And so if they show up to us, yes, we can engage them. But it depends on where they're at, right? We talk about stages of change when we look at it from a clinical standpoint. And that's something that takes time to move through, where they're like, I want something different, and I don't know how to get it. Or maybe, hey, I don't think I have a problem, but my PO says I have to be here. So if we can keep them engaged, we can help move them through those stages of change and hope that they become invested and engaged in treatment services. I would say that treatment takes time. Right? So if we say that we've offered them treatment and they didn't jump on board right away, that we need to recognize those other barriers that are playing a factor into their resistance. If I stop using drugs today, maybe I'm living in a house where people who use drugs, but if I leave, then I'm homeless, right? So if we can start to put in some of these provisions for people and get them connected to safe and sober housing, expand safe and sober housing options, start to look at those other barriers that aren't just drug use, I think that our success rate would be much better.
Thank you. Committee, any further questions for Ms. LaRocco? Seeing none, thank you so much for your testimony. Up next is Amy McKenzie. Please state your name and affiliation for the record, and then the podium is yours.
My name is Amy McKenzie, and I'm representing myself. Thank you for Chairman. I'm a licensed clinical professional counselor, and I'm also an advanced certified alcohol and drug counselor and work in substance abuse treatment, where I have been for the last 5 years. I'm asking you to vote no on House Bill 617, which would repeal safe syringe programs. I want to shed some light on the undeniable effectiveness of safe syringe programs in combating the spread of bloodborne infections, preventing overdose deaths, and also promoting public health, even in Idaho. Safe syringe programs have been proven to be a critical tool in addressing the needs of individuals who use drugs in Idaho. Data from the Idaho Department of Health and Welfare reveals that between 2014 and 2018, the state saw a significant increase in reported cases of hepatitis C, with a staggering 50% rise in new infections. This alarming trend underscores the urgent need for evidence-based interventions that prevent the further spread of infectious diseases like safe syringe programs. Safe syringe programs have shown to have promising results in mitigating that impact, even in Idaho. A study conducted by researchers at Boise State University found that individuals that access syringe exchange services were 5 times more likely to undergo testing for HIV and hepatitis C compared to those who didn't utilize the services. This demonstrates that there is a critical role that safe syringe programs play in facilitating access to testing and early detection of infectious diseases among vulnerable populations. Safe syringe programs have been instrumental in preventing overdose deaths in Idaho. According to the Idaho Office of Drug Policy, opioid-related overdose deaths in the state have steadily increased over the past decade and reached a record high in 2019. However, in 2022, as a result of the safe syringe programs, 1,351 overdoses were reversed. That's 1,351 Idahoans' lives that were saved and given the opportunity to engage in treatment and have a different life. Communities with access safe syringe programs have reported lower rates of fatal overdoses compared to those without such services. This highlights the life-saving potential of harm reduction initiatives in addressing the opioid crisis. In addition to the quantitative data supporting their effectiveness, safe syringe programs foster trust and rapport between the healthcare provider and a marginalized community in the state of Idaho. They provide an entry point for individuals who use drugs to access essential healthcare services, addiction treatment, and social support networks. By meeting people where they are without judgment or stigma, safe syringe programs empower the individuals.
Time that it's expired, but
Thank you.
Thank you. Any questions, committee, for Ms. McKenzie? Thank you for your time. Seeing none, we will carry on to the next. Up next is Robert Mowry.
I believe he has submitted written testimony this morning.
Okay, we do have written testimony submitted, so Norma Yeager.
Good morning. Thank you.
Please
Mr.
state your name and affiliation for the
I'm Norma
record.
Jager. I live in District 21, next door to the chairman, and in Meridian. I appear today representing Recovery Idaho, a nonprofit dedicated to support for people and families in seeking or needing recovery from addictions. I'm here to oppose House Bill 617. Please do not repeal the Syringe and Needle Exchange Act. There is a far better alternative. Amend Section 3406 by changing one word. Change may to shall promulgate rules necessary to enforce provisions of this chapter. This rulemaking process will put up some guardrails, will fix problems some have had with the current act, will bring people together to seek mutually acceptable provisions, will not throw the baby out with the bathwater by repealing the entire statute. Every year, because of this act in Idaho, over 500,000, that's million with an M, syringes, needles were removed from the public domain. 500,000 needles did not stick an unwary person, a sanitation worker, a kid on their way to school, did not transmit a serious and costly infection disease. That is a result to celebrate, not repeal. If the approach taken by the Idaho Harm Reduction Project was not acceptable to some, you must know that they are out of business. Simply reboot this act, maintain its benefits to Idahoans, while refining its operation in ways that can fit in each community in Idaho. Drug use is complex. Many approaches are needed. Prevention efforts matter. Overdoses must be reversed. Safer options to injection must be offered. Drug courts work. Treatment must be more accessible. Recovery must be supported. Please retain the Syringe and Needle Exchange Act, and let's work together to fix it. Thank you for your time.
Thank you. Committee, any questions for Ms. Jager? Representative Roberts.
Thank you, Mr. Chairman. And Ms. Yeager, can you repeat that code that you had mentioned to change the words from may to shall?
Ms. Jager.
Mr. Chairman, Representative Roberts, it is Section 373406. Currently, it says that the department may promulgate rules. It would say that it shall promulgate rules.
Thank you.
Any further questions? Thank you for your testimony. Up next, we have, let's see, Nicholas Kleinsworth. Please state your name and affiliation for the record, and the podium is yours.
Good morning, Mr. Chairman, members of the committee. My name is Nicholas Kleinworth, and I'm representing the Idaho Freedom Foundation. This bill repeals a program that has lost sight of its intended purpose to help get Idahoans out of the cycle of addiction. Key features of the Idaho Syringe Needle Exchange Act include connecting users with rehab services and reducing needle stick injuries in our communities. But neither of these key metrics are measured by the organizations running these programs or by the Idaho Department of Health and Welfare. This makes one wonder about the true efficacy of the program. These data points are crucial to understand whether we are truly reducing harm or contributing to it. In an age where dangerous drugs like fentanyl are so prevalent in our communities, we are playing Russian roulette of the most morbid variety. Overdose reversal products like naloxone are not magic. Sadly, for some, any one of these needles could be their last. Studies show that safe injection sites increase risky behavior, not reduce it. In these programs, we are giving people the tools they need to continue their addiction, rather than giving them the tools they need for help. Repealing this law does not preclude nonprofit organizations from helping their communities, like providing fentanyl test strips or connecting users to rehab services. And first responders will continue to receive and distribute naloxone. Rather, it says that as a state, we are no longer going to subsidize these dangerous and illegal activities with our tax dollars, particularly as some organizations running these programs have abused the system. To close, repealing the Syringe and Needle Exchange Act provides an opportunity for Idaho communities to refocus on treating addiction at its roots. With that, Mr. Chairman, I'll stand for any questions.
Thank you. Any questions for Mr. Kleinsworth? Representative Roberts.
Thank you, Mr. Chairman. And Mr. Kleinsworth, maybe you had mentioned that there's no indication of the efficacy of these programs. Do you have a method, or does your organization provide a method for measuring that?
Mr. Kleinsworth.
Mr. Chairman, Representative Roberts, when you look at the Syringe and Needle Exchange Act, it talks about making sure that we're reducing needle stick injuries in our communities, and also making sure that we're connecting people with rehab services. And currently, they're just not measured by any of the organizations. And so I would recommend that repealing this act would be the best way to approach that. But an alternative would probably be to also require agencies to collect that data.
Mr. Roberts, follow-up?
Follow-up, yes, thank you. So, but yet in earlier testimony, we heard that there was, 500,000 needles removed from our communities, and that's part of that exchange program. They are measuring at least the number of needles in that case. To me, I think that, without being able to come forward with a more efficient way of measuring that I disagree that the repeal of the program would be problematic more than helpful. But again, I don't believe that you answered the question as to whether or not that your organization would be able to provide a measurement system on these things.
Mr. Kleinsworth.
Mr. Chairman, Representative Roberts, let me just start by saying that the reduction of needles in the communities does not necessarily correlate with reduction of needle stick injuries. And then secondly, I'll also follow up with that question by saying that if you look at the reports provided by the Idaho Department of Health and Welfare for the last 3 years, there are actually more needles being put out into the communities than needles being collected by these programs. So we're actually not reducing the number of needles in our communities.
That's BS.
One more follow-up. Thank you, Mr. Chairman. But isn't that also a product of the fact that Idaho is the fastest growing state in the nation? Is that included in these calculations? Is that a possibility that's why we have more needles going out?
Mr. Kleinsworth.
Mr. Chairman, Representative Roberts, it is possible that the growth of our state has contributed to the increase in needle stick injuries, but could also be an indicator of the current decline in mental health for Americans overall.
Representative Rebell.
Thank you, Mr. Chairman, for a question.
Questions in order.
Thank you, Nicholas. I guess I had found very different data than what you're citing, and I was wondering if you could identify the source of your data. I had found for the CDC, based on 30 years of research, that participants in needle exchange programs are actually 5 times more likely to enter treatment and are 3.5 times more likely to stop injecting drugs. You had indicated that you had data to the contrary, that somehow needle exchange programs increase drug use, and I'm wondering where that data came from and how you would reconcile that with this 30-year study from the CDC.
Mr. Kleinsworth.
Mr. Chairman, Representative Rubel, the study that I cite actually noted that it increases risky behavior, does not increase drug use.
Follow up.
Thank you, Mr. Chairman. What is that study?
Mr. Kleinsworth.
Mr. Chairman, Representative Rubel, this is a meta-analysis from the National National Institute for Economic Research.
Any further questions from committee for Mr. Kleinsworth? Seeing none, thank you for your testimony.
Thank you, sir.
Up next, we will have Titus Folks.
Boy, was that
Please state your name and affiliation for the record, and the podium is yours.
Thank you, Mr. Chairman, members of the committee. My name is Titus Folks, and I serve as the Vice President at Idaho Family Policy Center. We support House Bill 617, and we think the sponsors will bring the bill forward. According to statewide public opinion polling that was commissioned by Idaho Family Policy Center in November of last year, 65% of likely Idaho voters oppose taxpayer-funded needle exchange programs. It's not hard to understand why. Needle exchange programs have devastated communities. Look no further than our northern neighbor Canada or nearby progressive states like California, Oregon, and Washington.
Oh, yes.
The problem with the so-called harm reduction approach is that these programs subsidize continued drug abuse. As Ronald Reagan said, if you want more of something, subsidize it. With all this in mind, it's understanding that a supermajority of likely Idaho voters believe that our state should abandon its commitment to enabling and subsidizing illicit drug use. Please take this opportunity to repeal the Syringe and Needle Exchange Act by voting House Bill 617 to the floor with a due pass recommendation.
Committee, any questions for Mr. Folks? Seeing none, thank you for your testimony.
Mr. Chairman, could the page distribute copies of my testimony to the members of the committee?
Yes, the page can bring the testimony.
How about putting it in a circle file?
All right, up next is Kate Heel. I hope I got that right. Please state your name and affiliation for the podium, for the record, and the podium is yours.
Hello. Thank you, Mr. Chairman and committee. My name is Dr. Kate Heil, and I'm a board-certified family medicine and addiction medicine physician in the Treasure Valley. I'm here to represent the Idaho Society of Addiction Medicine and our stance against House Bill 617. Addiction is a treatable brain disease. However, the road to recovery is often winding, and there are several stops along the way. One of these is when individuals are not yet ready to stop using a substance, but want to reduce harms from its use. This is where syringe service programs, or SSPs, provide vital care. Injection drug use is a risk factor for contracting HIV, Hep C, and other bloodborne diseases. If an individual injects drugs for 5 years, the risk of contracting hepatitis C by the end of those 5 years is about 50%. Medications to treat this disease cost about $40,000 to $75,000, and if left untreated, hepatitis C can lead to liver failure. I know this because I treat hepatitis C as part of my practice. For HIV, an SSP with a $5 million budget only needs to prevent 3 new HIV infections per year to be cost-saving. Services provided by SSPs like provision of clean needles, disposal of used needles, bloodborne disease testing, and referral for treatment is of great value. Interruption of treatment or closure actually creates a risk for bloodborne disease outbreak. Narcan, or naloxone, is a medication used to reverse an opioid overdose to prevent death. It's available by prescription as well as over the counter. However, it is expensive and may not be covered by insurance. SSPs that distribute Narcan to the community are saving lives. We have data to support this. Naloxone distribution in 2022 led to about 1,200 opioid reversals in Idaho. Almost all of my patients who have used opioids were they themselves revived with Narcan or used it on a friend or family member. The bottom line is people need to be alive in order to recover. The last duty of an SSP is to provide a bridge to treatment. People who participate in an SSP are 5 times as likely to enter drug treatment and about 3 times more likely to stop using drugs. Participation in an SSP shows that they are actively thinking about their health. I have had patients come to me because they learned about my services through an SSP. In conclusion, we stand with the greater medical community in support of SSPs. For Idahoans who use drugs but are not ready to engage in treatment, SSPs provide a way to prevent death and devastating disease and create a bridge to treatment. Other medical associations in support of SSPs include, but are not limited to, the American Society of Addiction Medicine, the American Medical Association, the Infectious Disease Society of America, the HIV Medicine Association, the American Nurses Association, and the Association of Nurses in AIDS Care. Thank you.
Thank you. Committee, any questions for Ms. Heil? Representative Wheeler.
Thank you, Mr. Chairman. And Dr. Heil, appreciate your testimony and your work for the citizens of the state. Could you speak to earlier testimony suggested that we could amend Section 37-3406 from may to shall? Could you speak to, from your perspective, the effectiveness of an amendment like that where the department would then promulgate rules?
Ms. Heil. Dr. Heil.
Thank you. So, Chairman and Representative Wheeler, I will first say that I'm a doctor, not a legal expert, but I think that sounds like a very reasonable provision. If the issue is that we need to create rules to follow or something like that, then I think that wording would create a reasonable rule to follow. Yeah.
Follow up, Mr. Chairman?
Follow-ups in order?
I'm curious also, Dr. Heil, if you wouldn't mind, you mentioned that you've had patients who found out about your services from SSPs. Can you talk about other ways that patients find out about your services? And in particular, could you speak to the effectiveness of, I believe they're called crisis recovery centers, in pointing patients to services such as yours?
Dr. Heil.
Can I ask a clarifying, what do you mean by crisis recovery center?
You can ask that, no problem.
Yeah. Well, Mr. Chairman, I apologize. I think I may be remembering the name incorrectly or the term incorrectly. If I could phone a friend, Representative Kingsley, I know, has some expertise and interest in that. What's the term that you had spoken to yesterday, Representative Kingsley, about?
Do you have Norma Jagger in the room, who's over recovery centers for the state?
Okay.
Is she still here? If you could speak to that, if you would have her, if you don't mind. Come on up to the microphone, if you would.
I believe and I hope the term you're looking for is recovery community centers. And certainly they are a source for connecting people to treatment and recovery. We talk about people not being ready. You have to understand that people addicted to opiates wake up in the morning sick. They wake up sick. And they know that as the day progresses, they are going to be sicker. That is why they come. That is why they continue to use. That is why we want them to start with clean needles. We want them to be exposed to other options, of course. But in the immediate term, it's not lack of readiness. It is physical discomfort, very serious physical discomfort. Recovery community centers, Representative.
Follow
up, I guess my question is, something like a recovery community center, how does it connect these patients with Dr. Heil or similar services?
Ms. Jager.
Representative Wheeler and Mr. Chairman, these centers have a wide array of resources to connect people to services that they may find useful. One center I'm very familiar with, not far from here, has a food pantry. People can come for food, and they get a pamphlet, and they meet with someone who is in recovery, who says, hey, bud, if there's anything I can do to help, I can point you in a different direction. People who come for safe syringes may have a family member who also comes with them, who talks with someone who is in recovery, who wants to help them, who doesn't want to judge them, who tells them there's physicians who can help you. There are treatment centers that can help you. There are many barriers to receiving that treatment, and we could do a lot to remove those barriers and make it easier. But there are many ways in which these centers, which bring people together who need help, with people who can offer hope as well as help.
And I can add to that as well. Thank you.
Go ahead, Dr. Heil.
Thank you. So I work in a doctor's office, meaning that I see people based on their scheduled appointments that are often set, like a couple days, couple weeks, whatever, in advance. We do also have same-day appointments as well. However, like Ms. Yeager said, that does create a barrier for some folks who are looking for treatment and looking for help. So these syringe service programs offer a low barrier to getting treatment. So let's say somebody wants to stop using drugs, or at least reduce harms from using drugs. At the moment, they can just walk in to one of these syringe service programs. They don't need an appointment. They can connect with someone who is in recovery themselves, or learn some information about safer injecting practices, get access to Narcan, and then learn about other places in the community, such as drug treatment centers, opioid treatment programs, or doctors in the community that can provide addiction medicine care. There are some lists available. So there's lists on, I believe, findhelpidaho.com, I believe. And then SAMHSA also has a list of physicians and providers who are able to provide MAT, or medication-assisted therapy, or medication-assisted treatment for opioid use disorder. However, what I will say is a lot of times those lists may actually not be updated and they may be out of date. But the syringe service programs do have more boots on the ground, up-to-date information about where to go for treatment and things like that.
Thank you, Ms. Heil. Representative Roberts.
Thank you, Mr. Chairman. And Dr. Heil, do you feel or do you believe that if this repeal was to pass through and we repealed the needles exchange program, even temporarily, if we were to come back next year and bring something back, if we repealed it for that time frame, would that increase risk to our communities for spread of HIV or hepatitis viruses? Dr. Heil.
Definitely. Yeah, that is one of the main things that I am worried about, not to mention the potential for overdose deaths. So I believe it's from the CDC, this information that about 1 in 10 new HIV cases is related to injection drug use. And so that is definitely a risk. Hepatitis C in particular, like I said, in individuals who inject drugs for 5 years, the risk of them contracting HIV or Hep C by the end of that 5 years is about 50%. So really, I don't think we have a year's time to just kind of sit on this and think about it, because the risk of communicable diseases is so high. Another disease to think about would be syphilis as well. That is another thing that is on the rise, and also potentially transmissible by injection drug use.
Thank you, Dr. Heil. Any further questions? Seeing none, thank you for your testimony.
Can the page distribute my testimony, please?
Yes. Page.
And I also have a written testimony on behalf of Idaho Society of Addiction Medicine. If that's
Absolutely.
Okay.
We will distribute that to the committee. Thank you so much.
Thank you.
Up next will be Del Chappelle. Thank you, Mr. Chappelle. Please state your name and affiliation for the record, and the podium is yours.
Hey, my name is Del Chappell.
Chappell, sorry.
It's okay. I'm not that fancy. It's just plain old Chappell. I live in Nampa, District 13. No, I heard this on the radio here. What was it, a couple months ago when they first started talking about that we had a needle exchange program here in Idaho? And I was like, what in the world are they talking about? Here's the issue with that. I support this. We need to get this out of here, because when you build these kind of programs, this is what you're going to build is Oregon, California, and if we don't stop it here and stop it now, it just gets worse. I mean, you could imagine where this is happening. It's downtown Boise area, and what do you see in Boise now? You see people laying on the street. And it's not that I'm not compassionate towards addiction, because I've actually been there. I took a lot of pain pills for a lot of years. People don't quit until they hit rock bottom. You can mother them and all these things that people want to do. I'm sure these ladies are very well intended, and I'm all for support for people trying to quit, but they don't quit till they're ready. And you're just enabling people by giving them syringes. We're calling it doing them a favor. We're doing them a favor to inject more toxic substances in their body that's actually destroying their life. It makes no sense. Rock bottom is what's going to fix them, and nothing else. And we don't have to live like this. We really don't. This is ridiculous. And this type of stuff, you guys have the most control over it. Get it out of our state. Get it out of here. It has no business here. We see the results. I mean, that's the thing I don't understand, is we see what it does. Look at California. Look at Oregon. The other gentleman mentioned Canada. This is what we're going to get. We have to stop it. So get rid of it. Thank you.
Any questions for Mr. Chappell?
Thank you.
Seeing none, thank you for your testimony.
Have a good one.
Up next, Julianne Donnelly. Please state your name and affiliation for the record. The podium is yours.
Thank you very much, Mr. Chair and members of the committee. My name is Julianne Donnelly Zool, and I represent the ACLU of Idaho here to oppose this bill. I would begin by offering in there is a judicial proceeding going against a needle exchange program currently, and that proceeding is where it belongs, in the courts, where facts can be gathered and can be measured carefully and judgment rendered. Here in this body, in the policy setting body, we should be relying on evidence, science, data to set good policy, to look at what statistically will impact Idahoans the most and the best. And the data is overwhelming on this issue area. There have been a lot of other speakers highlighting the greater likelihood to enter treatment, the greater likelihood to stop injecting. I'll add one statistic that other speakers haven't hit yet, which is that, and this is from the National Association of Counties, 90% of distributed syringes in needle exchange programs are returned. So, and I would just call out also the breadth of studies that describe this. I included in my written testimony a review of 133 unique studies, and the findings in them were consistent. They overall found the effectiveness of improving health outcomes for people who participate in this program. So, policy should be set by good data. The data here is quite conclusive. I urge you to look at increasing oversight rather than eliminating an important program for Idahoans' health. I stand for questions.
Thank you. Any questions for Ms. Donnelly? Zool?
Thank you.
I added that last piece. Seeing none, thank you for your testimony.
Thank you.
Up next, we're going to go to the virtual ones. These are the ones that take a moment to get together. Ian Trosseroy. Trosseroy, so how you say that, man.
Hi, can you hear me?
We sure can. State your name and affiliation for the podium.
Committee.
For the record.
Oh, go ahead.
Yeah, just if you would state your name and affiliation, then the podium's yours.
Thank you very much. Mr. Chairman, committee, my name is Ian Trosseroy. I'm from Pocatello. I'm a nurse practitioner and have worked in public health and primary care for my entire adult career. In 2019, when this passed, I did a doctoral project reviewing syringe exchange and its likely impact once legalized in Idaho. I understand this is a very counterintuitive subject. You know, when people from health professions tell you this helps, as an outsider, this is very counterintuitive. Why would it help to give people who are using drugs materials to use those drugs with? In 2019, when this passed, I reviewed all of the publicly available literature on this topic to better prepare stakeholders to think about this topic. And the reason is this. If for a moment, put yourself in the shoes of an injection drug user. Usually the limiting ingredient in the decision to use drugs is not the availability of a clean needle. The people who are addicted to opioids or other substances often continue to use despite significant risk and harm to themselves and the people they care about. It's not a lack of consequences like getting HIV or Hep C that stops them from using. It's an addictive process, and if it was under their control, they would stop. The number one killer of people between 25 and 45 right now is opioid overdose. Why don't they just stop? Because it's not really under their control. I can tell you from looking at all that literature that there's excellent evidence that syringe exchanges reduce HIV and Hep C, and that they don't seem to increase syringe litter, don't seem to increase injection drug use. From someone, like if you put yourself in the shoes of someone who's considering trying injection drugs or trying drugs, that person is also very unlikely to go to a syringe exchange. You know, they might use drugs that a friend offered them or that they found in their grandma's medicine cabinet. They're not going to use drugs because of the availability of a syringe exchange. The evidence just doesn't support that. Regarding the gentleman from the Idaho Freedom Foundation, I'm not familiar with that study, but I believe that's a safe injection facility, which is not what we have in Idaho. So we just have syringe exchange. So I'm not sure if that pertains.
Thank you for your
I really appreciate the committee.
Any questions for Mr. Tresor? Seeing none, thank you again for your testimony. We appreciate it. Up next will be Robert Mowry. And we did that one earlier in here. Sheila Weaver. Yeah. We see you. Thank you. If you would state your name and affiliation for the record, and the podium is yours. Oh, we're hearing you. We're hearing you in a strange way, like a chipmunk. Yeah, it's the broadband internet or something's failing. Yeah, we're just hearing squeaches. Sorry. No. We may just have to refer to your written testimony. We apologize. We're not able to get you in the. Yeah, it's just coming across as gibberish. Sorry. It says in here she's against the bill. Yeah, we will make sure if you would submit your written testimony, the committee can review that. So sorry, we can't get you on here in a proper way. Okay, committee, that is the final testifier. So if Representative Vandewater will prefer to come close, and then we will have the final discussion on the motions. If there is any substitute motions or anything like that, we'll move forward. Representative Vandewater.
Thank you, Mr. Chairman, and members of the committee. I'll try not to talk as fast as the last presenter. I want to thank everybody for their testimony. And I think we need to realize that the needle exchange isn't the only program we have in Idaho to help people that are addicted. We do have the recovery centers. We do have the behavioral health plan that is being implemented. And I think this is not to abandon the people that are hooked on drugs. I just feel that this program is not being run properly, and that needs to be done away with, and take a closer look at what else is out there and how we can provide it. And with that, committee, I would ask that you send House Bill 617 to the floor with a due pass recommendation.
Committee, we do have a due pass recommendation motion on the floor at this time. Representative Megan Blanksma, or Representative Blanksma, sorry, if you'd prefer to speak to your motion.
I would love to speak to my motion. The department has abused this section of code for years. It was intended for what these ladies said in a one-to-one exchange to try to get people help. And instead, the department has abused it by their rule promulgation. The good chairman and I have both tried to rein it in, tried to revamp it, tried to work within the code and the department to make it an effective program according to what the intention was of the original code. The department, as we all know, is fond of promulgating their own rules, going their own way, and ignoring what is in Idaho statute. And that's why this continues to be a problem. You can't fix this by putting a shall in there, because it's still rule promulgation authority. So I That's why I support what the chairman's doing. This is the right thing to do, to get rid of this code as written. And while I agree with the testimony that we need to provide people with help, this section of code needs to be completely rewritten. And we're at a time in session where I don't know that we can accomplish that. And I definitely know that we can't accomplish it through rulemaking authority. And so that's why I made the motion to support the bill.
Thank you. Representative Rebel.
Thank you for a substitute motion.
Substitute motion's in order.
I move instead that we send this to general orders, and if I might speak to that motion. I understand there's some dissatisfaction with this, although I would point out that the fact that there was a raid, I mean, we do live in a world where everybody is innocent until proven guilty, and I think the mere fact that there was a raid where the results are totally undetermined at this point, we have no idea if any wrongdoing will be found whatsoever. I don't think that it makes this an appropriate time to repeal a program that appears to be saving a lot of lives. We had a discussion on the floor recently on the fentanyl mandatory minimum sentencing bill where someone said, I'd rather get a call from the police than the morgue. I think this bill is going to rack up the number of calls we're going to get from the morgue. I take very seriously the data that's out there. There's data that these programs reduce HIV infections by 18%. As I said before, participants in needle exchange programs are 5 times more likely to seek treatment and 3.5 times more likely to stop injecting drugs. This is a life-saving program. If there are problems, let's fix those problems rather than completely throw the baby out with the bathwater. I have faith that this can be fixed on general orders. I have faith that there are guardrails that can be put on this. I think the Department of Health and Welfare is under new leadership right now. We have an opportunity to review rules. We have an opportunity to have input. I think the Department of Health and Welfare is very aware they're in the hot seat, and I think they will be very, very responsive to guidance that we give them on how we want this program to move forward. So I don't believe we're dealing with a rogue department at this point at all. And I think it would be a really lost opportunity here to save a lot of lives. I think very good points were made that we can't get people treated and we can't get them unaddicted unless they're alive. This is one of the best tools we have to keep people alive. And I think it would be really unfortunate to see this killed for a year. A lot of lives are going to be lost in that year. We can fix this program this year. Let's do that.
Thank you, Representative Rebel. So substitute motion is before us to send to general orders. Any discussion on that? And further, Representative Vanderwaal.
Thank you, Mr. Chairman. And just to speak against the substitute motion, I have talked to the current director at Health and Welfare, and he is fine with repealing. So he doesn't have an issue with repealing. He realizes that there's just a lot of work that needs to be done.
Representative Kingsley.
Thank you, Mr. Chairman. To speak for the original motion that I will be supporting, talk about the perfect paradox. Here we are. There's not a person in this building that doesn't want to stop addiction. And I remember in 2019 when we put this into place, the goal was to have through public health that it would be a real simple program that people would go in, exchange one for one, and how it became as big as it has, and it's just typical government, it's totally out of control. So I did have...
You are the government. Are you totally out of control, sir?
The person who brought the bill that said, we can relook at this, that we can do better. And I think that it does need to be killed. And then take it apart and put together to where it gets back to what the original intent was to be. But addiction's a beast. I mean, I've surrounded myself for trying to help people for the last 13 years. And the gentleman that spoke about rock bottom is absolutely right. But you've got to keep people alive to where they make that decision that they're going to turn their lives around. So with that, let's get a new bill. Let's get this thing designed that it can really be effective to help people. So with that, I'll be supporting the original motion. Thank you.
Oh, yeah, you would.
Representative Roberts.
Thank you, Mr. Chairman. To speak to the motion. Yes, people do need to hit rock bottom, and I think that individuals that are approaching these programs, the needle exchange programs, are at that point. But they do see some hope. They're reaching out. That needle exchange program, yes, we obviously need to address the issues within that. We can fix that. But I'm concerned that, releasing that beast for a year will make it even harder to put that beast back in its cage, within, that time frame. I think that, we should consider at least taking a look this year at changing this program rather than just complete repeal, because it will cost lives. Even if it costs one life, it's detrimental to others around that life. The possibility of bloodborne diseases being transmitted through our communities, even that increase in that time frame is hazardous to our communities. I think that it's up to us to be able to make that decision now, that we can try to fix the issue now rather than just repeal it and put it on the burner for next year. I think it's more important for us to try to address the issue now and protect our communities, to save one life, to save multiple lives. These individuals are at rock bottom. They are using substances to address their pains, whether they're physical, emotional, traumatic. They're not doing this because it's an easy choice for them to make. I've been a part of trying to help an individual get off of opioids, and it is not an easy process for those individuals. And it's much easier for them to revert even after they've come off of it, because it's an addiction. It's not something that a person just decides that it goes away. I think it's up to us as legislators to decide now that we can fix the issue now rather than put it on the back burner. So I will be for the motion to send to general orders.
Good.
Thank you, Representative Roberts. Any further discussion on the motion? Seeing none, Chairman will take a personal privilege, if you don't mind. This is my background, my professional life. I spent 30 years working. Right when I got out of college, I was working in drug treatment in an inpatient facility. I got to see my first person who was going through detox, and watching that on our detox unit, seeing the individuals who were trying to recover from these diseases that we're talking about today. Spent my whole career working to help these individuals in different ways, learning the science of it, overseeing it as a government official in some capacities that I've held, including these needle exchange programs. I've seen them reduce infection rates, seen them reduce HIV, hepatitis, and I've seen them help individuals. So I've been supportive of needle exchange programs. There's also some very clear, through discussion today, that we have a serious problem in Idaho right now with it not running properly. It needs to be when you run them properly, you've got medical attention on these individuals, and you're continuously seeking to get somebody to push them into the next phase of recovery, just like the good gentleman mentioned earlier who spoke about rock bottom. These individuals hit that rock bottom. You know what rock bottom is that I've seen? It's death. They do not come back. They're gone. And I've seen that happen. Some of the same individuals that we would have treated in those facilities that would have came to us but just hit too far on that rock bottom and didn't have an opportunity to come back from that. So I'm very passionate about this. It is very difficult when we see Idaho not doing it right, and we're not having the physicians look at them, and we had a good doctor speak to it. There's efforts out there. The rules definitely need to be reworked. As clear that has been clear today. I'm not in favor of repealing the entire program at the expense of those individuals on the ground and those rock bottom lives that will be affected. But I do feel very strongly that the Department of Health and Welfare needs to understand that this is a serious issue for our committee and that we need to address this in Idaho. And we can no longer stand for just allowing it to go as it has been. So for that reason, and many others in my professional career and my background involving this, I will support the substitute motion. Any further discussion? Seeing none. Could we do a voice vote or a roll call vote we'll do on this? So if you remember, a yes vote is that you're supporting the substitute motion to send to general orders. No vote is to not send to general orders.
Vice Chairman Erickson?
Yes.
Representative Blanksma?
No.
Representative Kingsley?
No.
Representative Mitchell?
No.
Representative Dixon? Representative Gallagher? Representative Healy? Representative Redmond? Representative Wheeler?
No.
Representative Hansen? Representative Rubel?
Yes.
Representative Roberts?
Yes.
Chairman Vandewoude?
No.
Party
A vote
line.
of
Yeah,
5 to 8, motion fails. So committee, we have before us a second motion to do pass, which is before us, and we
What do
will
you think
also
that's going to be, huh?
we do a roll call vote on this as well.
They didn't listen to anybody. Those 8. They
Vice
had their
Chairman
minds
Erickson?
already made up.
No.
Representative Blanksma?
Yes.
Representative Kingsley?
Yes.
Representative Mitchell?
Yes.
Representative Dixon? Representative Gallagher?
Yes.
Representative Healy? Representative Redmond?
Yes.
Representative Wheeler?
Yes.
Representative Hansen? Representative Rubel? Representative Roberts?
No.
Chairman Vandewoude?
Yes.
Motion carries. That's all the items we have on our agenda for today. I will turn the gavel back over to.
Now, did you learn something with this? Mr. Vanderwood has been in there, 16, 17, 18 years? And because they repealed the term limits, the Citizens Initiative term limits of 1995 in 2008, that would have limited Mr. Vanderwood to 8 years. When you have a guy like that in there for that period of time, that's one of the problems. Now, did those 8 listen to any of the testifiers except for the Idaho Freedom Foundation that's funded by ALEC, the American Legislative Exchange Council, the Charles Koch Industries funded organization? Did they listen to the doctors? Did they listen to the testimonies of people who have experienced family members who died from drug overdose? And I think I can safely say no.